Hi, my name is Dr. Kat Ralston and I'm a member of the Royal College of Physicians of Edinburgh's Trainees and Members Committee. I'm a Medical Education Fellow and Registrar in Geriatrics and General Medicine in South East Scotland. In the last episode of Clinical Conversations, Sustainability, Be Lazy to Save the Planet, I discussed sustainability in healthcare with Dr. Shauna Golden. Shauna was the first Medical Education Fellow in Sustainability in NHS Lothian. We discussed why striving for individual perfection isn't the answer and the importance of using your sphere of influence to drive change. We shared practical tips on how you can improve sustainability where you work, including projects that are win-win, saving the planet, saving money, and improving staff and patient experience. If you missed it, please have a listen. This week's episode is brief as we were highlighting related e-learning from the college. RCPE's CAFE group, the College Advisory Forum on the Environment, has produced e-learning based on their 10 Things a Doctor Can Do to Combat Climate Change initiative. This has been featured in the BMJ, the college's journal, JRCPE, and in Scotland's Chief Medical Officer's annual report. This e-learning can be accessed by anyone from the RCPE's education portal at learning.rcpe.ac.uk/10things. This e-learning covers preventative medicine, prescribing, investigations, telemedicine, waste, saving energy, commuting to work, a planetary health diet, sustainable quality improvement and advocacy. My colleague and friend Dr. Sarah Bartlett, who's the CAFE co-chair, will now explain more about this e-learning resource and its importance.
My name is Sarah Bartlett and I am a Care of the Elderly Registrar working in Edinburgh. I sit on the college's working group for sustainability, and together we've been working on producing resources to educate and inspire doctors to address their own carbon footprint within their practice. Why is this important? Global warming and pollutants in inspired air cause much morbidity and mortality, and doctors are increasingly concerned about the impact of our own work on the environment. The NHS accounts for 5% of UK emissions, and it's a complex, tangled web of organisations. It can be difficult to get to the bottom of what's going on. There is an appetite for improvement, and large-scale change is happening, particularly since the launch of the Net Zero NHS plan. However, as an individual clinician working in wards and clinics, it can feel frustrating and overwhelming. For myself, it was seeing the volumes of plastic single-use personal protective equipment being disposed of constantly working on the wards during and after the pandemic, particularly in contrast to my life outside work where I took care to recycle things and minimise my waste. And that was one of the driving forces behind beginning this initiative. So what can you do on an individual level to make sure your impact as a doctor is as low as it can be whilst keeping patients safe and practicing good medicine? You can do e-learning from the Royal College of Physicians of Edinburgh, all about climate change and how physicians can improve our practice to mitigate this from a healthcare perspective.
Thanks for listening.